welcome. Welcome to Black Women's Health Podcast. It's been a minute, and I'm really happy to say that I have a very special guest with me today. A guest that's not even in the United States. I'll let her explain that a little bit, but she is a family practitioner who, through a series of events, has evolved her practice into a very holistic wellness practice. So it is with great pleasure and honor that I say, welcome, Dr. Tomi.
Thank you so much for having me here. I come here with humility and just reflection on how, I got to this place of doing the work I did. I do. And trust me, it wasn't because I set it upon myself to yes, I'm going to do wellness and productivity coaching and talk about mental health and burnout, obviously with an emphasis on physicians and Black women as being a woman of color. But life has it. I am out of circumstance and I guess destiny.
Okay, so let's start at the beginning. Can you tell me where you were born?
Sure.
And how you got into medicine and your experience as a practitioner?
Yes. So I have lived in many continents in the world. I was born either in the motherland, in a country in Africa called Nigeria, but left as an 18-month-old. Moved to England with my family, moved to Canada, spent some time in the US, the Caribbean, then came back to Canada. And child of immigrant parents who started with their dream with basically nothing. And living in countries where you knew you didn't have much, but you made the best of it. And also the physician piece, my dad is a physician, and obviously that played a big role in me choosing medicine, but my choice to be a family physician was personal. That had nothing to do with anyone else. If anything, people discouraged me from being a family doctor, but I chose it anyway because that's where my heart was, because my heart is in families.
Can you talk about that a little bit more?
Yeah, so in medicine, there's like a hierarchy of specialties. Obviously sometimes a more I guess better paid, more respected specialties, maybe some surgical specialties or dermatology or other fields. But I wasn't interested in any of those. I loved family medicine because I got to nerd out and learn about many different body systems, how they interplay with each other. And quite frankly, because my goal was having kids and having a family, I thought this was a specialty that would help me have a strong knowledge base to help my family. And little did I know that that knowledge base actually saved my life multiple times. And my second child, it helped me save her life because at one point I ended up having to do CPR on my child
Oh,
when she was 4 days old. So really looking
oh.
back in the 20 plus years since I started this journey of getting into medical school, I reflect and I'm just I'm grateful for the experiences, even though some of the experiences were challenging. But I think if I hadn't had all the challenges, I wouldn't be doing the work I'm doing now. Because quite frankly, part of the reason I started was out of hurt and anger. Because I'm something needs to change in the system. And I don't like this. I didn't like how I was treated. I didn't like my experience. Something needs to change and we need to speak up. So that's where it started. My action was not because I wanted to be an advocate. I wanted to be in this niche outside kind of medicine, but it was life. And I had a choice. Either I find my voice or someone speaks for me. So I chose the latter. Well, I chose the first one. I found my voice.
That's very interesting because I think that a lot of people seldom hear the perspective of a doctor.
Yes, it's true.
So how long had you been practicing? Were you a resident still in training?
Yeah.
Were you out of your training? When you say you had encounters, negative encounters, can you elaborate and be a little more specific?
100%. Oh, 100%. So for me, things really hit the fan about a decade into practice. Though my experience as a Black woman in a white man's world in a healthcare system, education system was generally negative. Okay. Whether I was traveling, whether I was a patient, whether I was a student getting taught, I knew that the way I was treated was different than the people who were less melanated than me.
Can you be
And
specific?
yeah, for
What
sure.
happened
Let
to
me,
you that
yeah. So the one that really hits me the most was motherhood. We know that Black women have the highest mortality rate
Mhm.
for complications. Well, I was a statistic. You know, my first pregnancy, I hemorrhaged 5 times. Actually, twice. The first one, five. The second time, I remember when I first hemorrhaged with my first pregnancy. I told the nurse, I'm like, I'm bleeding. Can you come check me? She said, oh, I'm fine. You're fine. I just checked you because I had hemorrhaged an hour before. She walked out the room. Well, my family came and looked and saw clots coming out of me and called like they had to call a code on me. And this
oh,
is a Black woman who works in a hospital, who was being treated in a hospital where she worked out of. And my dad worked out of that hospital. So it's like, And then the second pregnancy, I left that city to have a child outside because I just didn't feel safe where I worked. Unfortunately, I came back when the baby was 2 days old. And when she was 4 days old, I fed her, put her on my lap after burping her, interacted with my family. And moments later, I looked at her. She was stiff as a board. She wasn't breathing. Her color was off. And I panicked. But thank God I had the wisdom to do CPR. And I just like went, I don't even know what I did. I went at her. I applied pressure. My baby came around, thank God, took her to the hospital. You know, they told me it was just reflux. I'm like, really? Reflux stops you from breathing, but okay. They admitted her. And then, as a mama bear who doesn't trust the system that she works in, even though she serves them, I stayed awake. This is 4 day post C-section. And my baby's oxygen levels dropped in that 8 hour period, like 6 or 8 times, so as low as 51%. And she was seizing. And I remember telling the nurses, this is happening. And they're like, oh, it's just reflux. Oh, it's fine. Your baby's fine. It's just the monitor. They'll change the monitor and the same thing would happen again. So I'm like, okay, I'm not crazy. If my experience is the same and it's the same place I served that I've given my best for, and I'm like, I can't even get a break. And shortly after that, go figure, I was like done. I was like burnt out. Pandemic started. Social supports were removed from one because of all the restrictions we know of. And I just said, you know what? I need to pause. So for the first time in my life, I took a break from practicing medicine because I had basically been in school since age 4. Because in the UK, you start school early. Most countries, you start school early. So I took up stress leave. I couldn't do it. Like I just couldn't do it. And that was where the healing process started, where I allowed myself to be human, allowed myself to reflect on where I was and why I was angry for good reasons. And why I was like, you know what, if this is happening to me as a Black educated woman, how much more my sisters and people who don't have the knowledge, who trust these healthcare professionals, and they get screwed over. So I said, no, let's do this. Let's talk. Let's use this voice because if I don't, who else will? Because people are
so
scared.
that's a horrible story. I mean, because I hear you saying that you were a practicing physician within the hospital, which means they knew you.
They knew me. They even said, I know you because I trained in that PEDS unit. I did rotations there. So they
Oh
knew
my,
me. I was a student there and a physician.
and and now you're there, you're an attending physician,
Yes, yes.
and you say something is wrong,
They
and
don't believe me.
and you get disregarded.
You get disregarded. Yeah. So my little baby, after 8 hours, I called a colleague who's a female pediatrician and she happened to be Black. I said, look, this is what's happened to me on the ward. She's like, oh my goodness, has the doctor not been called? I'm like, no, they won't call a doctor. Even though like there's orders that say call a doctor if oxygen levels are less than 95%. My baby was 51% and seizing and going unconscious as I was nursing her multiple times. So they finally called the doctor after my friend called the doctor. My baby was in ICU, and guess what? I became a patient because after that, my body hemorrhaged. I that was a pregnancy with 5 hemorrhages. Anyway, that's another story. But the main thing, it hit me hard was my cub. Because when you mess with a mama bear's cub, then it's no turning back. It's one thing messing with me for 20 plus years. I can deal with it even though it hurt. But when it's my child, then you cross the line where I'm like, no, we're not gonna stop.
So clarification, were you in Canada or were you in the United
I
States?
wish I was in the US because I would have been paid. It was in Canada, right? The universal healthcare system, a place where discrimination does not exist. That's garbage. It was in Canada, actually.
So that's eye-opening for
It is.
us in the States,
Oh yeah, no, I
where
wish it was in the
that
US.
type of bad care is not unheard of.
Oh, it's not unheard of. Mm-mm. It is not. It's just not spoken of publicly often, or you're hush-hushed, or you're gaslit, or you're just treated badly. So it's just
Okay.
what it is.
And hopefully your children are fine.
Oh, thank God. My youngest one, even though she had a rough start, she
Yes,
is very talkative, very active, a beautiful
fantastic.
joy. And
We're
I'm
happy
thankful.
to know that. All
Oh
right,
yeah.
but that was the impetus for you. You said enough.
Enough. It was my children. It was one thing me, but then it was my kids.
Okay.
That's when the line was crossed. I'm like, mm.
And what decision did you make at that point?
Oh, a major decision. So I'd been stewing about leaving that place for years because I didn't like it, but loyalty had me there because I'm very loyal. But at that point, I'm like, no. When I saw leadership for who they were and how things were panning out, I was just like, nope, nope, no. I'm not sacrificing my happiness anymore because I was miserable. Okay. I was not happy. I was burnt out. I was exhausted. I was barely hanging on. And I was like, no. And
Can
I
I
left.
ask you,
Go ahead.
what city were you in?
I was in a province with a really long name. It's called Saskatchewan.
Yeah, yeah.
Yeah. It's in the capital city there.
Okay.
And I I sold my practice, I sold my office, and I literally packed my bags and left. And it was hard because I'd been there for a long time. I had amazing relationships with my patients, like great care. I
Sure,
was happy.
sure.
Like I had family there, but it wasn't enough because my safety, psychological safety, my children's safety had been jeopardized over and over again. And because they would never apologize,
Yes,
never acknowledge wrong, even when you complain, I'm like, you know what? You're beyond help. I cannot stay here. They
right.
just gaslit you and I was just like, no, it just didn't make sense. And then, you move on and you realize that the grass can be greener on the other side. You can water your grasses, you can do your best, but truly, sometimes you have to go to the other side and be like, you know what? I can't believe I worked in those conditions or lived there, but that is life. Sometimes you just have to take the bold step of faith and go through the changes. But in my life, I'm grateful for it.
Sure,
Grateful to be
sure.
alive. I'm grateful for my children. I'm grateful for all the good, bad, and uglies, you
That
know?
was such a major decision to close the
Yeah.
practice, not look back, and to
No.
relocate.
Yeah, I relocated and who knows, I'll probably relocate again in the future because I just, I'm just like at this point in life is so short. You don't know how long you're going to be gifted with. There's no need to settle. You
Right.
know, um, there's so many, there's so many people that need to hear this message and to be encouraged.
Absolutely.
And I've decided I take my message where people actually care to listen and will make change, who will actually do something with it.
Okay.
Right?
So
That's the point.
where did you move to?
Well, I moved to a province more west called Alberta by the Rocky Mountains. Like I have beautiful mountain views every day. It's beautiful. I love it. Though, my heart is still back in the US. So even though things are crazy there right now, I'm just like, I think eventually I will move back.
Interesting.
Yeah,
Interesting.
I know, right?
So,
Crazy.
so this is a fascinating story. So you relocate and you say at this point, I don't want to be a family practitioner, or what's the
Yeah,
thinking
so
going on?
part of me didn't want to do family practice anymore. But I took a break and I paused after I moved. I'm like, I still love family practice. I still love primary care, educating people, which is great. And I'm good at it. However, I would rather serve many over just one-to-one,
Gotcha.
right? If I can use my experience, insight, and convey a message that pushes towards change, then that's where I'm at. I'm past I still do one-to-one. I have my own patients here. They love me. I love them. It's great. But with this story, this message, this experience, is me, I want to be where policy can change, because there are solutions to our current plagues, to our challenges, and they're actually fairly simple, but somebody has to have the foresight, the knowledge, the strength to make change.
That's so true. So what do you do now?
So I still do family practice. However, I still do a lot of I coach, I do keynotes. I'm starting to be involved in advocacy groups, just, getting a feel for who's aligning with me for the next stage of my life,
Yes.
right? That's where I am right now. So I'm spreading my message, and I have been vocal for years with my social media platforms, my podcast, et cetera. But I feel like this new journey, this new season of my life, it will be a period of growth and expansion, and really pushing this message forward, because I don't accept the status quo that it's just the way it is, they can't change. That is absolute garbage. Because
Yes.
there are solutions to so many of our healthcare challenges. We do not have to be a chronically sick nation. We can be strong for ourselves and our children's children. So let's do better. And all these inequalities, they don't have to be there. They're human made. We can break them. So
Yes.
that's the next step.
So one of the causes that you picked up along the way has to do with burnout.
Yes.
Physician burnout is what I really like to talk with you about.
Sounds good.
And as horrible as your experiences were, it also sounds as though you may have had an element of physician burnout.
Oh, 100%. So
So
yeah,
let's not assume. How do you identify or how do you diagnose physician burnout?
that's a really good question, because the evolution of my thinking about burnout has changed from the textbook burnout definition, where it's like frustration, just feeling like disconnected with your work. And that's true. That does happen. You can be frustrated, disconnected, moral injury, where you're seeing horrible things happen to patients who don't have insurance or other factors outside their control. Yes, that's burnout. But burnout is so much more. So I had to first come to terms with the root causes of my burnout and really discuss the elephant in the room. So I have this updated burnout triad, which I have come to the conclusion based on my experiences and also the experience of my clients. So burnout is the sum of three critical relationships in your life. And you can either have positive energy balance, which is feeling great, or negative energy balance, which is burnout. Okay. Those three critical relationships. The foundation is your relationship with yourself, how you see yourself, your past, your present, and your experiences, right? So while you manage your expectations, because if you don't deal with that, it doesn't matter if you go to the best place in, Neverland or some utopian paradise, you're still going to be burnt out because you haven't dealt with yourself, right? And that's a hard one for many of us to work through. The second one, which was, I call it the elephant in the room, is relationship with significant other, intimate partner. Because if that relationship is not strong, it will impact you negatively. There's only so much you can overcompensate with being a rock star at work and interchange work. If you don't have that strong, supportive core around you, it's a struggle. Okay. And then the third piece of burnout in this equation is your relationship with work and society. So in my life, my relationship with self was okay, but I had to really go back in my experience and figure out, why was I a people pleaser? Why did I take on so much? Well, because I was told I was never enough, right? Why did I do this? So I had to understand that and come to terms with it and heal and work on that process. The second piece was relationship with significant others, partner. My partner then and I, the relationship was not strong. There was not a support. It wasn't until I realized that this is not working, even if I changed my relationship with myself and relationship with work and society, there's an issue. So that's that. And then third, work and society, you have to have a good workplace. Like you cannot, there's only so many fires you can put out on any given day. Right? And you have the choice to get up from where you're working and search for other jobs and quit. Take a break, take a leave if it's beyond toxic. So those three things, just like the stools of the three legs of a stool, you need all three to support the weight. And that stool can only hold so much weight. As with our lives, we can only do so much before we crush, even with good supports.
So that's interesting because they've done a couple of studies which say that women are more likely to experience burnout than men.
100%.
Women doctors are more likely to experience burnout than
yes.
And
yes.
as no surprise, people of color, minorities are more likely to experience burnout. So is burnout a diagnosis? Is it a medical diagnosis? Is it like anxiety, depression?
No, I think we've gone, I think burnout is a relationship issue. Okay. It's not like a chemical imbalance. It's a relationship issue. There's a power energy imbalance. There's a reason women burn out more than men. Well, traditionally, women were typically keeping the family together as far as children, household responsibility, and plus they're working outside the home. That's exhausting. There's a reason in studies they say marriage is protective for men when it comes to burnout, but not so much for women. I wonder why. Right? Let's just keep it real. There's a reason why during COVID, the pandemic, a lot of relationships went sideways. Well, they were already sideways, but they really went sideways because because at this point they had to face the person in their home, people in their lives. Right? It's the elephant in the room. Burnout is a relationship issue. We as humans are interconnected. We need healthy relationships.
So what's a Black professional woman, a Black female doctor to do? Because you do have, I mean, how do you deal with self? How do you deal with relationship or lack thereof?
Yes.
How do you deal with, the hospital and all those other things? How do you protect yourself?
Yes.
In that type of setting?
That's a really good question. And I really hope more women at the beginning of their career are hearing this message because it's a lot easier when you start. Because when you try to have healthy boundaries, when you've already established the fact that you are available 24/7, you skip your lunch breaks for people, you are there, yes, you are. They're like jumping, you're like, how high? It's really hard to pedal back. It is possible, but it is really hard. And the people that benefited from you having no boundaries or limited boundaries will fight against you. And that's the reality.
Well, how much control do you have if you are a resident taking call, or if you're now an employed physician in a system that has these expectations as to your hours of employment and how many patients you're supposed to see?
That is very challenging, especially the residency piece, because you basically have to do whatever they ask you to. You definitely try to vocalize your concerns, how it may be impacting your efficiency, your productivity, and slant it in a way that it's for their benefit that you take these breaks. And if you are given breaks, as in days off for sick leave, vacation leave, use them. Okay? Use them. It's not a badge of honor to have them not be used. Self-care is important, relationship with the self. Food is medicine. What you eat will fuel you. You pick your fuel. Right? You pick your fuel. The people that are around you. You can choose your friends. If your social circle is very toxic, or the person closest to you is very toxic and refuses to change, you have a choice. Yes, the system is a challenge. That one we're still working on. That's like my next project. This system needs to change. Even the
Absolutely.
system needs to change, and it will eventually change.
Well, some people are starting to acknowledge that there's a problem. Uh,
Yes.
the degree of burnout with physicians, pretty much like you said, increased as a result of COVID
Oh yeah.
and the strain that was placed on
100%.
doctors. Now, people are recognizing it's a problem, but the question is, what do we do, and what do you offer your clients?
Well, it's one-on-one personalized care where we first have those discussions where they can actually listen to someone who's not going to judge them, who's not going to report them to anybody. It's confidential. Like, what is going on in your life? Let's start with the foundation, because it's a lot easy to say, okay, the work is this, work is that, but the foundation is you. It carries a bigger weight, literally. So let's start there. And then let's look at people close to you, intimate partners, who's in your circle, what's going on there. And yes, the icing on the cake, work and society. But letting people know you have more power than you realize.
Mhm,
And eventually, collectively, we are stronger
mhm.
than on our own.
Yeah,
But it's first having those discussions, because as physicians, we don't like vulnerability because it's frowned down upon. We're taught not to be vulnerable,
mhm, mhm,
right? But
mhm.
having a safe place where it's like, I've been there. I've been my lowest of lows, and a lot of them. And I've also been high, like happy, great experience. But the happiness came after going through the lowest of lows and having to learn some pretty hard lessons. But I'm thankful I'm still standing, I'm still breathing, I'm still here, I'm still loving what I do, I'm still living this life of a physician. And I recently wrote a book that's coming out this summer. It's called The Soul Sucking, Energy Draining Life of a Physician: How to Live a Life of Service Without Losing Yourself. So let's be real. If this job, it is soul sucking. Like, you cannot go through everything you go through and not be impacted. It is energy draining, but you can still live a life of service, which is why I believe the majority of us went into this field to serve, to help, to make a difference without losing yourself.
That's a really good point. And I think that someone listening might say, oh, please, these are doctors just crying the blues.
Oh, I know.
What do they have to complain about? But there's
Yeah.
a ripple effect,
Mm-hmm.
meaning that if I'm burnt out and
Mm-hmm.
I'm just barely hanging in there, I really don't want to talk to patients.
Mm-mm.
I don't really want to engage. And patients feel that. And patients will say, I go to the doctor and they don't have time for me. They don't listen to me. I don't feel heard.
Yeah.
And that's true, but that may be part of the reason, maybe that
Definitely part of the
their
reason.
doctor is suffering from burnout and doesn't have the wherewithal to provide that type of care that a person needs. And so it's important. It's important for the doctor, it's important for the patient, and it's important for the sustaining of any type of healthcare system.
100%. Physician burnout is a healthcare crisis. We are already in a crisis. There are not enough doctors to go around. They say in the next
That's
few years
true.
we'll be
That's the other
shy,
point.
right, by almost
Physician
a quarter
shortage.
million physicians. Quarter of million. That
And
is a
you
lot.
wonder why that is.
This
Because if it's a profession where you can be of service and make a living, why would there be a shortage? You would think people would be gravitating, running,
No.
but
If
it,
anything, female physicians, after 6 years in practice, 40% of female physicians go part-time or they quit entirely. 40%. And the majority of medical school applicants are women. And the majority of physicians in primary care are women. So if it's important to you to have your stage 1 cancer diagnosed rather than stage 4 when you present to the emergency with shortness of breath and weight loss, then you want strong family care. You want strong physicians. You want a physician who is wellness minded, who believes in prevention, who practices what they preach. They're a better role model to you.
You know, that's a great point, because this study about burnout in the States said that they listed the 5 professions
Yes.
that tend to experience burnout: ER,
Yes.
OBGYN,
Oh, yes.
family medicine.
Mm-hmm.
And these are all the doctors that you meet on initial encounter. And
Yes.
if they're burnt out,
Yes.
what is your quality? I think over half of the doctors surveyed were burnt out.
Oh yeah, well over half. It's staggering, and each year the numbers kind of go higher and higher.
Yeah,
And it's like that in the US and in Canada and abroad. Like,
yeah,
let me, for
that's a
those who are listening
problem.
who are poo-pooing doctors, there's a reason why so many people, if they go into medical school, they turn back around and say, hell no. For the amount of work that you do and the liability and risk and the things you miss out on your work, the pay for most people isn't worth it. It isn't for the money.
That's saying a lot.
It isn't, because trust me, I at one point when I was burnt out, I remember hitting my head against the table in my office. I'm like, why the hell was someone this smart with so many skills be doing medicine? Like, I have patients who are like plumbers and doing this. They're like making easy $500,000. Plus they have pensions and this, and they get to go home, spend time with their kids, have a quarter of the education. I'm like, it really isn't that amazing. Yes, there's some exceptions, but what's the price of missing out on your kids' first steps?
Mm.
What's the price of mourning the loss of a grandparent while you're at work? What's the price of going through pain, laboring while seeing patients?
Mm.
Like, what's the price of your life being under a microscope
Mhm. Mhm.
and being responsible for somebody from the moment they are born till decades down the road?
Mhm.
It is not a life, necessarily a life of ease. Most, it's not. It's a sacrifice.
Yeah.
And there are countries of the world where doctors get respect, but and the pay is atrocious. So
Yeah,
don't.
it's interesting in that the salary can seem very attractive, but so many medical students graduate with a huge debt.
$250,000
Yeah.
with interest.
Um, they kind of lose whatever autonomy they might have when they
Yeah.
become employees.
Hmm.
And then it's hard to practice self-care. So what does self-care look like? You mentioned diet, and I
Yeah.
guess that's undeniable. You know, as they say it, junk in, junk out.
Yeah.
But what else does self-care, what does self-care look?
Yeah. Self-care means 79 hours of sleep as much as you can. Self-care means journaling. Self-care means doing those simple things that give you pleasure. Remember before you got into medical school when you used to enjoy going yoga or going dancing or crocheting? Those things. Like, I literally was 10 years in and I'm like, I haven't read a book outside medicine in over a decade. I missed reading. I missed it. I have a deck. I haven't gone on my deck and read a book. Self-care can be mani-pedi. Self-care can be so many things, things that inspire you, encourage you to do better.
Mhm.
That's what I want. I want self-care to grow you, to nurture you.
Yes.
Okay? That's self-care.
Okay. It's finding your joy
Finding your joy, finding your passion, purpose outside of medicine.
outside of medicine,
Out,
having a life
having a life
outside of medicine,
outside of
which
medicine.
is seems like a no-brainer, but it's not that easy. You get caught
It's,
up in the
you
matrix.
get caught up. You're busy, you got a call, you got this, you got that. You seem you don't have time. But sometimes you have to just be like, you know what? I'll rather work less and have joy and figure out. I know that you have many other skills and talents. You can do other things with your time. So wait, you can enjoy the practice of medicine
Yeah.
and still fill your cup and let the cup overflow. So you're giving from a place of abundance rather than you're giving from a place of scarcity. Because that's what I did for a very long time. I was giving when I had nothing left to give. When I was on my last drop, I was giving. And you cannot do that.
And I
Because
suppose that's true with any and everyone, irregardless of what your
everybody, everybody.
profession or job may be. At
Yes.
your job, but it seems like such an investment. I
Yeah.
went to school all these years. I have all of this indebtedness.
Mhm.
I want to be good at what I do.
Yes.
It's a real investment. And then to say, well, you need to have a life. You
You
need
need to
to
have a life of your own because if or when work chews you up and spits you out, you will be filled with so much regret. And that is a reality. If and when life happens, and let's say you're a surgeon and something happens to your hand, your dominant hand, and you're no longer able to make those intricate sutures, I pray to God you have something else that gives you joy because you are more than your MD. You are way more than your MD.
Absolutely. Absolutely. And it's interesting that it's the primary care fields that seem to have the burnout
Oh, there's
so more
so
so
many reasons.
than the surgical specialties. In fact, I think the one specialty that had the least burnout was plastic surgeons.
Yeah.
Yeah.
There's many reasons for primary care burnout. The administrative back paperwork is atrocious.
Oh, absolutely.
Right?
Absolutely. And it's an eye-opening conversation with you to know that this is not just specific to the United States.
No. Other first world countries want to pretend it's a North America phenomenon. It's in Canada and it's in the United States. We struggle with our EMRs, the EHRs, the paperwork, the pay is generally significantly less than other specialties,
Right.
right? There's so many factors. Uh, and also you're responsible for the patients for a longer period of time, especially if you do primary care. Like when I did emergency work, patient will come present with whatever challenge, you do your best to stabilize the situation, you help, and then they go. You're done with them. Primary care, if there's still a problem, they're going to come back. So you better be a solution, right? It's not one and done. It is for the good, the bad, and the ugly, the tedious stuff, the stuff that's not fun, hearing their challenges, which may even trigger your own if you've had similar experiences, but still trying to keep a professional stance. Like it's a lot.
Mhm.
Hearing chronic pain, hearing about sorrows, challenge, like unless you have no heart, it's impossible not to be impacted.
Mhm. Mhm. Well, it looks like you found a good place for yourself.
Oh, I'm grateful. Yeah, I
That's
am.
fantastic. And so you're walking the walk and living the life.
Yes.
Okay. So do you have any suggestions to um Black female doctors specifically, or anyone who might be feeling, oh, let me ask you this.
Yeah.
How would I know I'm burnt out?
Oh, you just don't care anymore. You're done. You're just like exhausted. You've lost your happiness, that extra oomph in your steps. You just don't care. You're just
Yeah,
like, I'm
yeah,
done. It's
I think
frustrating.
I think that's true because I too believe that I experienced burnt out in the past. And what it is you just don't care. You just don't
Hmm.
feel like it. I
Hmm.
mean, things that used to bring you, um,
Happy.
yeah, you're depleted.
Hmm.
You mentioned that, you're this vessel full of water and the water is being drained out to the point that there's just nothing there. There's
There's nothing.
nothing there. You
Exactly.
don't have anything to give.
There's nothing. There's
Yeah,
holes in your cup even. It's just whatever's going in is going right out.
that's right.
And you're done. You're
And you
just
haven't taken the time to fill the vessel.
done.
So you have
Exactly.
nothing to give.
Nothing.
Yeah.
Yeah.
Yeah. That's good. That's good. And so if someone wanted to um find your book or talk with you or maybe
Yeah,
even schedule, I don't know if you could a consultation. I mean, luckily
yeah.
this is heard in a number of different countries and possibly there's someone in Canada.
Oh yeah. So it's easy. You can be anywhere in the world and I can be of service to you. And that's the beautiful thing about coaching. It's not license dependent on state or country. So on my website, there's a book a free consultation link. The website name is long, but I'll give you an easy way to get there. It's holistic with an H, holistic wellness strategies. So there's 3 S's with the wellness strategy and then strategies.com. Or it's much easier if you just search Dr. Tomi Mitchell. You'll see my LinkedIn profile where I'm very active. Just send me a message, connect with me, and then we go from there. So Dr. Tomi Mitchell, Mitchell, LinkedIn. I'm there every day. So just holler and we can connect, and it doesn't matter where you are. And that's the beautiful thing with technology.
That is the beautiful thing with technology, that we could speak, and it's been my pleasure.
Thank you so much for having me here.